Next is Dr. Natasha Roberts, who's the Implementation Science Lead for this CRE, and she's going to talk to us about the importance of partner design in projects.
Yeah. Thank you. Hi, everybody. So I'm Natasha Roberts, and so I have a position here in CRE Respond, leading implementation science, but also more generally the End User and Consumer Committee, which I'll speak to a little bit now. So this is actually a quote that was given to me by a consumer rep I've worked with in the cancer space, Leona Young, and she puts it at the beginning of all of her presentations, that partnership can't happen without having everyone at the same table. And so there's a couple of touch points, I guess, that I wanted to sort of draw attention to when we talk about partnership. And this presentation is about partnership with consumers, but also partnership with our clinical colleagues and much more broadly. So everyone has a lived experience that they bring to the table. All of us researchers have experiences that we bring from our personal lives, but also our research and whatever our background or trade is as well, that we bring to research, and that is really important as a tool to use in how we develop research and how we conduct our research and understand what we find. But our research also impacts people when we do the research and then with the findings that we have. And so I guess it's really important to very early on understand who we're partnering with, have the right people sitting at the table so that we can utilise that lived experience and have the impact that we really want. And so that can really happen by understanding the needs of our partners, and that can be our patients, their families and their supports, the communities around them, but also the clinical teams that we work very, very closely with, executives in health systems, the health services themselves, what the needs of those are, industry partners, not-for-profit partners, government. Like, there's a plethora of partners that we're working with all the time. In the consumer space, I'll just draw attention to that. It's an area I'm very passionate about. I'm a clinician as well, and I tend to take that a bit more for granted, but I've really experienced the benefits of working with consumers and the outcomes that can be very powerful when it's done properly. So these are just some definitions to sort of, and I won't read them out, but if you want to take some time to cast your eyes over them, we're sort of drowning a little bit in terminology, and it's good to just have a clear understanding about what we're talking about when we're partnering with people, because it also helps understand what roles and experiences that we're sort of bringing them onto the project to use. And there's partnership, but there's also embedding the voices of all of those around us in the research, and that can be done in a variety of ways, whether it's through qualitative work, cross-sectional surveys or outcome surveys, interviews, focus groups. Digital storytelling is a method that I've been exposed to recently, which I found really powerful. We've got really good ways of measuring things quantitatively, using patient-reported outcomes, or even setting ourselves up for future exploratory work through patient-reported experience measures. And, you know, having the voices of our partners in our research design, I think, is a really good way to help plan for future research. There's a lot of expectations now that we will use those partnerships as part of our research, but also report on them and share what we learn. And through that, at the moment, a lot of us are still doing that intuitively. We've been designing a lot of our research protocols just by bringing together a team that we think is great, but I think there's taking that extra step of explicitly saying what those roles are and reporting how those people contributed so that we can build further knowledge about that. And so I guess what do we mean by end user engagement and research? So I'm moving out a bit more broadly from consumers and just looking at our end users more generally. And so engagement can cover many areas in healthcare and healthcare research. As I was saying, it recognises the lived experiences of those that are involved, and it gives a critical perspective that helps also build the expertise of the research team. And it means that the collaboration is meaningful, but it can also be incorporated into your governance structures, ensure that you're setting the priorities that are reflective of your broader population, and also help with knowledge translation. And there's plenty of guidance around consumer, and here's a quote here: consumer and community involvement is about research being carried out with or by consumers and community members rather than to or for them. And we're seeing that NHMRC was quite an early adopter with providing this guidance, but it's sort of blossoming in lots of areas. And also our health services are now, for accreditation, there's an expectation that there will be that partnership with consumers very, very much integrated to how we deliver care. And so we're also seeing GCP guidelines of now the new iteration has that very, very strong emphasis on consumer engagement. We've got the European guidelines for use of medicine. So it's becoming more and more about doing research in partnership with people rather than doing it on them. And that, I honestly believe, that also includes our clinical teams. And so there is, what's interesting about consumer engagement specifically, so I'll just go back, is that internationally work has happened in silos. And we recently did an umbrella review looking at patient engagement in quality of life research. And we found that because it had been happening all around about the same time, people were using different terms. There was the approach was a bit different, but the essence and the spirit was the same no matter what. So internationally, we have a plethora of resources as well. So I just talked to, I'm going to have to look back here because I haven't, oh no, they're on my shirt. I'm getting older. So just a couple of tools to sort of highlight how you can make the most of partnership. So of course there's inclusiveness, ensuring you've got diversity with those people you're partnering with, that your partnership is broad, that there's cultural sensitivity, and you avoid tokenism, that it's genuine partnership and everyone's sitting down at the table having that conversation. And that there's supports in place to do that, that you have budget for it, that people get compensated for their time, that it's safe, that it's accessible, that you take the time to have those conversations, that you watch the language that you're using as you move between you meeting people where they're at, acknowledging that we all have different competencies with technology, that we're flexible, that we provide training, we give people the chance to learn, and that we evaluate everything so that it's sustainable. And obviously there's the mutual respect aspects with lived experience, that we build relationships, we're collaborating, that we're available when people need us, and we acknowledge people's contributions, and ensure that we protect confidentiality. People bring their stories to us, but we have to check that it's people are willing to share those in detail. And then finally, co-building, having good communication strategies set up in the beginning, role clarity, that people are clear what their role is, what they're bringing to the table, start things early, keep building together, even if it's an iterative process, often and throughout a project, and have a keen eye on knowledge and dissemination. And then evaluate, keep building, keep learning, keep growing. So that's all from me. Thank you.
Fantastic. Thanks, Natasha. It's a very nice description of all the things that we need to think about to build the most effective protocols for study, because if we're not making the most of that opportunity to collect as much data which can allow the best results to be described, then it doesn't give an opportunity for someone like Lisa Waddell to transform that information into treatment guidelines.